Hello, everyone. I'm here to discuss my summary of research proposal. And as I have introduced a couple of weeks ago, my research question is how effective is current mobile health intervention in improving TB treatment adherence in East African countries? Uh, I have a couple of motivating realities to consider this research. Number one, TB burden is high in East African countries. As a matter of fact, I lost my mother from TB, so it has some kind of personal connection with my life. And when I think of treatment that adherence in TB, it is a little bit complicated. It takes longer time, and there is a lot of socioeconomic factors that they can play negatively to follow adherence. But we have another reality now. Mobile phone usage is growing globally, including in East Africa. So, considering these two realities, conducting this research will be something meaningful. Uh, Before going to my hypothesis and other methodology discussions, I tried to read multiple articles that are written in this subject in TB treatment and health informatics intervention. And I come up with a broader overview and impact assessment, indicating examples, trend evaluation, and indicators of EHR integration. And I will discuss it as following. When it comes to developing countries like the East African countries, uh, anything is pretty much with a lot of challenge, especially the healthcare and health informatics would be something that can experience considerable challenges. So, a researcher at India Institute of Medical Sciences by the name of Surya Bali uh, come up with a good, identification of barriers to development of telemedicine in developing countries, including mobile health. So in a good article, and I got just three important points filtered out from that reading. So underdeveloped infrastructure, poor governance, and political instability has uh, the strong impact in practicing mobile health and in harvesting effective results such as the TB treatment adherence. Having this in mind, I went ahead and see whether there were a research that can show us a possible practice regardless of these potential hindrances. So I found a research who actually was recently published March 29th, 2025. Uh, Researchers Abayomi Abiyani and Jose Locase, they are researchers at South African Walter Sisulu University, have a very recent publication, and they have this article with health informatics, elements of digital health, which is telemedicine, and mobile health has emerged as transformative solution to healthcare access challenges in sub-Saharan Africa. I think the specific um, focus of their study was in Nigeria, Kenya, and South Africa. So they come up with the adoption prospectus and policy implications of telemedicine in general, and mobile health was incorporated in their research. Um, when you see these three countries, there are some practical examples that we can consider the benefit of health informatics in the healthcare system in general and in treatment adherence at specific level. So when we see Kenya uh, has great accomplishment with mobile health integration, South Africa to some extent, And Nigeria is with scalability. The technology is growing, and it is there is exemplary practice of healthcare informatics with scalability. And if you see South Africa, they also have this national telemedicine policy and regulations, which can be um, a benchmark to other countries. So all in all, this shows us there are considerable advancements uh, in the Africa continent when it comes to health informatics intervention to healthcare treatments, adherence, and other factors for sure. Uh, but it doesn't show us whether the interventions were specifically effective to my specific concern, TB treatment adherence. It is a systematic overview. It provided current condition in some African countries, but the focus countries are also known for better infrastructure. So while it gives a great glance of understanding about healthcare informatics in Africa, but having, the countries are comparably better, doing better in infrastructure, governance, and everything, it may not specifically reflect the condition that I want to assess. Another research by Marian Somarai, D. Boyer, and her colleagues reads like implementation and effectiveness of EveryMed with short message services, reminders, and tailored feedback compared to standard care on adherence to treatment among tuberculosis patients in Kilimanjaro, Tanzania. Now they speak in my language. I saw that the literature assessment was narrowed down to my specific research question. So researchers at Kilimanjaro University, Tanzania, gave a specific attention to effectiveness of mobile health intervention, and they evaluated a specific device known as EveryMed. This is the device. It is a box which can contain 1 month's medication, TB medication, and it has also a mobile connection that can send a short message to a system every time the user opens this box. The communication would be sent out to expecting agency and report them, hey, he's using or she's using the medication. They assess the effectiveness compared to standard care at the time. They found out that this device EveryMed to improve adherence. It has a limitation though. The limitation is the device counts every opening of the box, not actual medication intake. So, it might relate to patient behavior that might need some sort of education, but it is a good advancement. With healthcare education and patient discipline, this can give a great deal of information about adherence when it comes to TB treatment. Another research by Ahmed Osman Ali and Martin Prince at Maastricht University in Netherlands, titled as Mobile Health to Improve Adherence to Tuberculosis Treatment in Khartoum State, Sudan. Now they go close to my attention to Sudan, East Africa. Also considered as a part of the East Mediterranean region. Well, they have this comparison, the patients assigned according to inclusion and exclusion criteria. The cases are all newly diagnosed TB patients with positive result, and they received mobile text message and with usual follow-up, while the control group, no mobile text message or calls, but usual follow-up. And they have basic line data, socioeconomic data, disease intervention and treatment intervention process, but the control group does with a standard process. And they try to show promising results. But in fact, Sudan shoulders 15% of the TB burden in the East Mediterranean region, has the second highest active TB response. Well, this makes it a good place to assess an actual result of mobile health intervention. So, the global expansion in cell phone use produces new opportunity to incorporate cell phones into healthcare delivery, as used in Sudan. The research is an intervention comparison, and there is a promising result, like I said, to lower treatment default in patients with TB using mobile devices, which is good. They indicated that it is a introductory research. It requires further study. So my attention will be also some sort of helpful addition. Another one is a research by Sabine Hermans and her colleagues at Macquarie University College of Health Sciences, Kampala, Uganda. This is a similar research, comparison research, text messaging to decrease tuberculosis treatment, attrition in TB and HIV, co-infection in Uganda. And it was a great reading. It is, like I said, it's a similar comparison study. SMS reminder did not show an effect on TB treatment. Well, there is a question. So there is inconsistency in the research findings. Some research, like in Khartoum, showed a promising result, but in Uganda, there is no clear effect of this intervention, which opens a door for further study. I also considered reading a few more articles about the EHR integration with mobile health, if it can enhance or improve effectiveness of mobile health intervention to cases like TB treatment adherence. I found a good example. One is the mobile Uzima. It's a mobile electronic health record system. And a research by Martin Chang and his friends, it's assist the MUZIMA, which is an open source Android application. It allows users to, access historical patient data and at the same time collect new data for decision support. It does not indicate if it helped the mobile health effectiveness, though. It shows great integration that can help, the decision makers at the further end, but for users, it doesn't show whether it motivates them, it increased adherence, and some sort of visible effectiveness of the mobile health intervention. I also try to see, integration in developed countries so I can use it as a benchmark, what kind of features they are applying to get better results. If I would like to consider as a recommendation to the developing countries like East African countries who are using mobile health intervention to lower treatment defaults. I have a research here which was supported by Precision Medicine Institute of the United States. And the title is Impact of the Electronic Health Record, Integrated Personal Health Record on Patient Participation in Healthcare System. It gives a decent information about the integration of EHR would support patient participation, meaning adherence, follow-up, and treatment quality in general. There is also another research about wearable health technology and electronic health record integration, which is visible example to my case. The wearable technology would communicate with the HR to enhance patient participation information in general healthcare effectiveness. that was done by Catherine and Rachel, Sarah, and Devin as researchers. So having this general understanding and synthesized state of literature, I come up with the following hypothesis. Number one, patients who utilize mobile halls will show higher treatment adherence compared to those who do not. In fact, some of the literatures that we reviewed showed this, but some of them do not. So my additional effort will figure out which one is actually in place. Second one is current mobile health intervention lack significant effectiveness. Third one is integrating EHRs with mobile health will increase the effectiveness of mobile health intervention in improving TB treatment adherence. I have some logic behind this. Logic number one is TB treatment stays for about 6 months. So it requires some kind of intervention. So with the growing use of mobile devices and other mechanisms of healthcare information, users will be motivated, redirected, and disciplined on their treatment adherence. As mentioned in the state of literature, effectiveness is currently inconsistent. So it would be worthy of reviewing that situation. Integration resulted well and enhances meaningful patient participation in the developed countries. So we will see if that is the case, and data that we will analyze will show us for sure. Research methodology that I'm going to use is a mixed methodology which combine quantitative and qualitative methods. And this will be a base for my data collection approach as well. Due to time limitation and resource limitation, my proposal will be focused on secondary data. I can obtain helpful data from national TB program records in East Africa, and even the World Health Organization report has some kind of data that I can utilize. Data analysis. My data analysis will be comparing adherence rates using chi-square, t-test, and logistic regression, among others. Having the categorical data and group comparison will be benefited by using chi-square results. If I may have to use a smaller sample, which is more likely, the t-test is great too, to represent the potential big population. The interpretability of the logistic regression for binary classification, for example, users and non-users, will be another help to come up with a meaningful analysis of such a research. And this is what it looks like. Please forward your comments, and I will welcome everything. Thank you.